So we can think of thermal agents in therapy as sort of two sides, heating and cooling. So we're going to talk about cooling first. Cryotherapy or cold therapy. The learning objectives, I want you to be able to describe or explain how the use of cryotherapy controls inflammation and edema, and that is primarily what we use it for, although there are other uses. And one of them being spasm reduction. So what is the role of cryotherapy in spasm reduction? We want to state the appropriate application timeline of therapy for acute inflammation. When do we use cryotherapy? 3 ways cryotherapy can control pain, and why is there a lasting effect after the ice is removed? I want you to be able to state the contraindications and precautions for cryotherapy and why these physical agents may be potentially harmful. So on the board exams, you are frequently going to see for modalities, you're not going to see a lot of how to apply modalities, but you're going to see things with contraindications and precautions. So this is something to know really well. A lot of people do charts. I made like a spreadsheet because I'm a spreadsheet person. I made a spreadsheet of all the contraindications, indications, and precautions for the different modalities. Everybody does theirs differently. You figure out a way to understand it for you. It's listed in your contraindications and precautions are listed in your textbook, in your lab manual, and in Physio U. Lots of information about that. So know those contraindications and precautions. You should be able to state the common sequence of sensation in response to cryotherapy. And in a way, one of the reasons we want to know that is because we want to know what to tell our patients to expect. So, cold has a lot of physiological effects on the body. It has hemodynamic, neuromuscular, and metabolic effects. So, hemodynamic effects, initially, when you first apply cold, there's a decrease in blood flow because of vasoconstriction. The neuromuscular effects, it decreases nerve conduction velocity. You can see how that might be helpful in pain management. It increases the pain threshold, which that is also helpful in pain management. It can alter your muscle strength, and we'll talk about how it does that, and decrease spasticity. It can also facilitate muscle contraction, and you will learn more about the application of that in your neuro rehab class next spring, how to facilitate muscle control and decrease spasticity with cold. The metabolic effects of cold are that it decreases your metabolic rate. That makes sense, right? It's very commonsensical. That's the thing that I like about modalities is they do make sense on a real physical, hands-on kind of level. So here's how cryotherapy decreases your blood flow. Decreased temperature causes decreased blood viscosity, increased blood viscosity, decreased release of the vasodilators, histamine, and prostaglandins. And it stimulates cutaneous thermoreceptors to stimulate smooth muscle contraction, which stimulates vasoconstriction because of the little precapillary sphincters are smooth muscles. The cutaneous thermoreceptors also affect the spinal cord dorsal root ganglion, like we talked about in the pain theory lecture. They increase sympathetic androgenic activation, and overall, the result is decreased blood flow. And so decreased blood flow can be useful for lots of things, for reducing inflammation and affecting pain. Cryotherapy is really helpful for that. So we're going to use cryotherapy. So these are kind of our indications for, so when we talk about every modality, we're going to talk indications, contraindications, and precautions. So when do we use it? We use it to control inflammation. We use it to control edema. We use it for pain control, for prolonged icing to modify spasticity. Symptom management in MS in the way of a cooling vest is often used. MS is frequently responsive to increased temperatures, and a cooling vest can be really helpful for managing those symptoms. Neuromuscular facilitation and cryogenics and cryostretch, which we will demonstrate in lab. It'll be fun. Contraindications and precautions for cryotherapy. The contraindications include cold hypersensitivity. Cold intolerance, cryoglobulinemia, which means you get a release of globulins in your blood, immunoglobulins in your blood in response to cold. Paroxysmal cold hemoglobinuria, which means you get more hemoglobin in your urine. It happens in response to cold. It's not common, but there you go. Raynaud's disease, which is where you have impaired temperature sensation in one or more fingers. Areas of regenerating peripheral nerves, because we don't want to slow down nerve conduction, and areas of circulatory compromise. Those are all contraindications. Don't use cold if people have those things. Precautions, over the main branch of a superficial main branch of a nerve, if you want to see the effects of this, stick your elbow in an ice bath until your little pinky gets numb because you numbed out your ulnar nerve. It works. If you have an open wound, that's probably not a good thing to put cold on it, but you could. You don't necessarily want to, but you could. So it's a precaution. So you can think of contraindications and precautions as absolute contraindications, like just don't do it, and precautions are relative contraindications. So think about it. Maybe you'll do it, maybe you don't. Hypertension, because anytime we're messing with blood viscosity and blood flow, that could potentially affect uncontrolled hypertension. If someone has poor sensation or poor mentation, or if they're very young or very old, maybe modalities are not for them. So those are always precautions. Potential adverse effects of cryotherapy, tissue death or damage. So tissue damage can occur when temperature reaches 15 degrees Celsius, freezing or frostbite between 4 to 15 degrees Celsius. So I have actually had a patient give themselves frostbite in the summer by using ice packs. So it's a danger if you're not monitoring the time that you're doing cryotherapy. You always want to keep the tissue temperature above 15 degrees Celsius and keep the application time to 30 minutes or less. So what I always tell people as a rule of thumb is put the ice pack on for 20 minutes and then leave it off for at least 40 minutes to allow your tissues to come back up to room temperature, body temperature. So out of an hour, you can ice 1/3 of the hour. So 20 minutes out of every hour, you can ice. Don't leave the ice on continuously. So we're going to apply cold with a cold pack or ice pack. Most commonly, we're going to do that. Ice massage, which we'll do in the lab. And that can be a really useful tool for just getting that pain right down. Right down. You got a really painful spot, you're going to ice massage it. Controlled cold compression unit, like a Game Ready or one of those things, and we're going to do that in lab as well. Or a vapocoolant spray. So these are some examples of ice packs. One of them is just a plain old bag of ice. Or sometimes people put isopropyl alcohol and water in a bag so it makes a flexible ice pack. Our basic gel or clay packs that we use in the clinic, ice popsicles, ice massage, lots of different cold packs that you keep in the freezer. These gel packs are nice because they hold the cold for a long time. And especially if you're in the clinic and you're taking them in and out all the time, they hold the cold longer. Ice massage, a lot of times, if you've probably seen these in the clinic, the little ice massage cups, it's a two-part and you put ice in it and then you can just pull it out and use it for ice massage. I always tell people if I'm instructing them how to do it at home, you can just take an ice cube, wrap a little tea towel around it and do the same thing. Works really well because not everybody has these little doodads at home. You can also use just like a little paper cup and freeze the ice in it and then peel the paper cup off. In the olden days, we used to have styrofoam cups. We would use those, but this is what you see in the clinic most of the time. Controlled cold compression, like the Game Ready systems, those are really common use in post-surgical or orthopedic injuries. And they work. They work great. Vapor coolant spray for a really quick spray and stretch, which we'll demonstrate in lab. That'll be fun. Those are quick ways to apply cold to the body. So we're going to document, even though it is a no charge treatment, we can't charge for ice packs because it's something people can do at home. It doesn't require special skill or training. We do want to educate our patients on contraindications and precautions and when to ice. But still, even though we're not charging for it, we're still going to document it in our chart. We're going to say the area treated, what cooling agent we use, the treatment duration, patient positioning, and their response to intervention. So if their skin is like super red or blotchy after the intervention, you want to write that down and just and have them check it in half an hour or so. Should be back to normal in half an hour. So when you're trying to choose between cryotherapy and thermotherapy, and a lot of times this is a question from a patient, they say, should I use heat or ice on it? I don't know. Let's look at the chart. So both of them decrease pain. Both of them decrease muscle spasm. Um, Cryotherapy decreases blood flow and thermotherapy increases blood flow. So if you're trying to decrease inflammation, cryotherapy is probably your choice in the first few days of the inflammatory response. Edema formation, cryotherapy decreases edema and thermotherapy increases edema. So if you're trying to address edema, you want to use cryotherapy. Cryotherapy decreases nerve conduction velocity and thermotherapy increases it. So if you're trying to address pain, in terms of like direct acute nerve pain, then cryotherapy is often your choice. Sometimes, always, but it often is your choice. Thermotherapy increases metabolic rate and cryotherapy decreases metabolic rate. So if you're doing it to try to speed up healing, thermotherapy might be your choice. Collagen extensibility, thermotherapy increases it, cryotherapy decreases it. So if we're trying to increase our collagen extensibility, we want thermotherapy. The cryotherapy increases joint stiffness and thermotherapy decreases it. So obviously, if you want to increase joint mobility, sometimes that increase in joint stiffness is worth it to decrease the pain and edema and muscle spasm. It's worth it to use cryotherapy for a short amount of time. Spasticity is decreased with cryotherapy, and thermotherapy has no effect on spasticity. So if you're trying to modify spasticity, cryotherapy is your choice. We'll review this again when we talk about thermotherapy.